We're joined now by Kristen Schuster, a project manager with Mountain Pacific. Kristen's going to talk about some of the exciting things happening in primary care today and how you as a patient can benefit. Thanks, Kristen, for being with us.
Thank you.
Absolutely. Earlier in the show, we talked about the importance of establishing a relationship with a physician and developing that plan. Can you talk a little bit more about how you would go about doing that as a patient?
Absolutely. I think one of the important things to think about, especially if you have Medicare Part B, is looking at your annual wellness visit, or AWV. You'll hear that kind of thrown around in the clinics. So that does stand for annual wellness visit. It's a 100% covered benefit for you to truly sit down and talk with your provider and make a plan for the upcoming year. This could involve preventive maintenance, some chronic care management, as well as care management services for things that may come up over the year. It's really a talking visit. It's not a physical exam visit. So it's a little bit different than, say, an annual physical.
Okay. So you gave kind of a fairly large list of things that would happen. Can you tell us what else a patient might expect in that annual wellness visit?
Absolutely. So as I said, it's really a talking visit. So you're going to have some information that is discussed back and forth with your provider. This could include tobacco screening questions, maybe depression screenings, asking about your diet, goals for your health care, and really getting to know you at a deeper level as a patient.
So is there something that a patient could prepare for before they go so they can be ready to talk about some of these things with their healthcare provider?
Absolutely. Questions are a great place to start. So if you're new to Medicare, it's a great time to sit down and talk with your provider about what you can expect with this new insurance. Medicare is a little bit different than some of the commercial policies that are out on the market. Another good place to start is medications. So if you're on an extensive list of medications, it's great to either bring a list or, better yet, bring the bottles with the instructions. And keep in mind, this isn't just medications that your primary care provider has provided to you. This could be medications if you were recently discharged from the hospital or if you're seeing another specialist.
Okay. So when you go in and have this visit with your physician, you're probably seeing other people within the clinic or the office. How can these other people, like the receptionist and the nurse, how are they part of this annual wellness visit? How would that interaction take place?
Great question. So I think what's really important is with care now moving forward, we're going past just the nurse and provider being involved in your care. It's really extended to all people located in the office. So you may find that the registration process takes a little bit longer because the front desk person may be asking you some additional questions. You may find that there's a care manager that comes in the room that does a screening before the provider comes in the room. Don't be alarmed. This is just a growing of the care team to provide more comprehensive care to the patients.
Okay, so that's great advice. For some of us, that is going to be a big departure than what we have been used to. So it's great to know that and help people prepare. So I'm understanding, and we hear the term patient-centered medical home. Is that really what you're talking about here, is that concept in action in this clinic?
Absolutely. So Montana has been really expansive with patient-centered medical home over the last 7 years or so. The medical home is really moving from one-on-one provider to patient care to really incorporating whole patient care and team care. So this is really looking at you, the patient, as a whole, and how can these other care team members really deliver in all areas of your care. This can include comprehensiveness and coordination with other providers that you may be seeing, care management if you've got a complicated condition like diabetes or high blood pressure, and really just bringing kind of more team members on board to provide support.
Wow, that sounds like a really comprehensive approach, and it seems really wonderful. One thing that comes to my mind is the cost associated with that. Does this inflate the cost, or can you tell us a little bit more about the cost for a patient-centered medical home encounter?
Right. So the importance has really been to stress treating patients for preventive care versus treating patients for just sick care. So less reactive medicine and more proactive medicine. With that, providers are receiving greater reimbursement to provide this service from the insurance companies like CMS, Medicare Part B, and commercial payers in the state. This isn't adding any additional cost to the patient. It's just giving the providers some financial support to build these very robust care teams.
Okay, so with a patient-centered medical home model, you may not go to all of these different people, or you may not see them in one visit. Can you tell me a little bit about how your physician or your primary care provider coordinates all of this maybe in the background that you're not even aware of?
Yeah, I think technology plays a huge factor in that. So you'll notice now that providers aren't writing in their paper charts anymore.
Right.
They have computers. So they're documenting in that so the care team members behind the scenes can really see what's going on in your overall care. So if you're referred out to a cardiologist, the care team members are going to be able to see that. You may not need to take advantage of all of the care team members, say in one visit, but if you transition care from a hospital setting, maybe you need some additional support, you may receive a phone call from a care team member that you may not be familiar with, maybe a care manager, a nurse case navigator, something like that, but all of those people are there behind the scenes to meet your needs when you need them.
So in a nutshell, is this really what care management is?
Absolutely.
Okay.
Yep.
So is there anything more that you would like to share with us on what care management is, or is that basically, is that a good definition for us?
Well, I think that's a starting point, right?
Yeah,
It's a pretty
always
big,
a starting
right?
point.
Pretty big topic. One of the areas of care management that I think is really evolving and growing is getting the patients to be very active in developing what we call a care plan. And so the patient-centered care plan is incorporating not only the clinical goals of improving your health, but also asking what is important to you. So we all know that keeping your diabetes is important, but what's important to you may be playing with your grandkids or your kids.
Absolutely.
So that's a more meaningful goal for patients, and we want to incorporate that into those care plans. And that's really the core of care management.
Great definition. Thank you so
Yeah,
much.
absolutely.
And thank you for the great information that you shared with us.
Thank you. Thank you.
I'd like to thank Kristen and Meg, and thank you at home for watching. Until we meet again, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.